If you feel unsteady, most people immediately blame their legs. But sometimes the missing piece is what your eyes are not picking up, or what your ears and hearing are making harder for your brain to manage. Stay with me, because by the end of this video you will know 5 simple checks and fixes that could make walking feel safer, especially on stairs, in dim light, or in busy places. Hi, I'm Amged Khairy Selim, consultant geriatrician, older people's medicine, and welcome to Age Well with Dr. Amged. So why this matters? Balance is not just about leg strength. It also depends on how well you see the world around you and how well your inner ear helps your brain judge movement and position. So if you feel unsteady, it is worth thinking beyond the legs alone. The first fix is simple. Don't ignore changing vision. A lot of people think my sight is not perfect, but that's just age. But blur, poorer contrast, and more glare can make walking less safe, especially when judging steps, curbs, stair edges, or uneven ground. An eye test is not just about reading letters on a chart. It is also a falls prevention tool. If you are aged 60 or over, check your NHS entitlement to free sight tests. And even if you pay privately, an eye test is still a falls prevention tool, not a luxury. Fix number 2. Be extra careful with stairs if you wear varifocals or bifocals. Many people can read perfectly well, but still misjudge edges on stairs or steps, especially in dim light. That's because some glasses can affect how clearly you see the lower part of your visual field. So if stairs feel more difficult than they used to, do not ignore that. Use the handrail, slow down, make sure the lighting is good. And at your next eye test, ask whether a separate walking pair or another adjustment might be sensible for you. Third fix. Blur and glare are not always something you just have to live with. Cataracts are a good example. People often say, my vision is just a bit cloudy, or headlights really dazzle me now. But if cataracts are contributing to visual impairment, treatment may be available. So I would not brush off blur, glare, or struggling more in lower light as just getting older. Sometimes there is a treatable reason behind it. Fix number 4. Hearing problems can affect balance and attention too. This surprises people. The inner ear is part of the balance system, and hearing loss can also make walking less safe by increasing the mental effort needed to understand what is happening around you. Even when hearing loss is not directly causing imbalance, it can still make walking harder in noisy places, crowds, or unfamiliar environments, because more attention is being used up just trying to hear. If the TV is getting louder, conversations are harder to follow, or you feel unsettled in busy places, it is worth mentioning that. A GP can refer for a hearing assessment. And if hearing loss comes on suddenly or gets worse quickly over days or weeks, do not wait for a routine appointment. Seek urgent advice, please. Fix number 5. Use the tools you have been given. Glasses and hearing aids are not a sign of decline. They are independent equipment. If you have been prescribed glasses, wear the right pair for the right task and keep them clean. Poor contrast on a gray stair edge can be enough to trip anyone. And if you have hearing aids, wearing them, especially in more demanding environments, may help reduce the mental strain of trying to hear, which can make walking feel safer and more manageable. This matters for more than just avoiding a fall. It also matters for confidence. Because when vision or hearing starts to let you down, people often become more cautious, less confident, and less willing to go out, use the stairs, or move around unfamiliar places. Falls prevention is not about avoiding life. It is about making life safer, so you can stay active and independent for longer. If you are supporting a parent, partner, or loved one, eye and hearing appointment are often some of the most fixable wins. Offer practical help. That might mean offering a lift, helping write down symptoms beforehand, or noticing patterns they may not mention themselves. For example, glare when walking at night, difficulty hearing in groups, hesitation on stairs, seeming off balance in supermarkets, or avoiding situations you used to manage comfortably. These are useful clues. So here are my advice for today. If you haven't had an eye test in the last 2 years, check whether you are due one and book it. If family members say the TV is too loud or you are struggling more in conversations, ask about a hearing test. And if unsteadiness are affecting your confidence or day-to-day life, book a falls review, because sometimes the problem is not just in the legs. Sometimes the missing piece is the eyes, the ears, or both. Stay steady, stay active, and I will see you in the next video. And please do not forget to subscribe to this channel so you don't miss the rest of this important series on staying safe and independent.